One study of 45,000 women found more than half reported going to their OBGYN for all their health care needs, with less than 6% of them seeing a primary care physician.
If women think that they're just going to get their annual GYN exam or their pap smear and kind of that's it and that's what women's health boils down to, I think that's a big problem.
The American College of OBGYNs also recommend women have an annual well-woman exam with other specialists in addition to a checkup with their gynecologist to monitor things like heart disease, cognitive and mental health, risk of diabetes and cancer, obesity and nutrition, bone density, and vaccinations. But getting to a primary care physician is only the first hurdle. Doctors we spoke to say women should be on alert for potential gender bias in their own doctor's office, adding it's a systemic problem. A study by the University of Copenhagen found that Danish women were diagnosed an average of 4 years later than men for diseases like cancer and diabetes. And while the topic has not been extensively studied here, doctors we spoke to believe it's likely also true in the United States. Why is it that so many women say they go to their doctors and they say, you know, I'm having these symptoms and they feel like they're being dismissed? Is that the way it is for women out on the front lines of health?
I think the way that women are being viewed, how their symptoms are being viewed are changing. There's a lot to learn about gender and sex differences on how we present ourselves, even to the doctor, and even the diagnostic tools that we used for, let's say, heart health. Symptoms we know are different.
Dr. Fiona Gupta is a neurologist at Mount Sinai in New York City. She says the gender gap in doctors' offices is a real concern.
Women make up half of the U.S. population. They play a larger role in caregiving. Yet, when it comes to their health, women are not being treated equally. We know that women have a higher rate of misdiagnoses, later diagnoses. Their symptoms are often, under-recognized. And then I have a lot of patients who were told that their experiences were psychosomatic or in your head.
That's what happened to Carol Savaggio 6 years ago. The then 59-year-old was active and healthy, never missing a doctor's visit, when she began to experience crippling anxiety attacks.
Over the course of the 11 months, I probably went to 5 neurologists, and I went to 2 orthopedic doctors. I had told them I thought I had Parkinson's, and they totally basically dismissed it and said that they just didn't think that that was it, and that I should go to a psychiatrist.
She was prescribed Klonopin for the anxiety and physical therapy for arm pain. But after demanding more tests, she was diagnosed with Parkinson's disease.
It was frustrating. We wasted a lot of time, a lot of money. Not sure all that was necessary if they had just listened a little bit more.
Carol eventually found an ally in Dr. Gupta and says she finally feels heard. What are the biggest gender and sex differences when it comes to medicine?
Women are not little men. And every cell in our body is different. It has different genetic makeup.
So really that we're looking at an emerging field in a way in medicine, which is women's health.
Exactly. This is an emerging area of medicine, women's health.
Women's health is way behind men's health, not only in terms of research, but also in terms of how much women need to advocate for themselves. So here are some tips straight from the experts. Start a health journal, keeping a log of symptoms with dates and times, and if possible, send that information to your doctor ahead of your visit to optimize the time you have with your doctor. And this, very important, trust your gut and question your diagnosis or the plan of action if it doesn't feel right. And of course, if you don't feel heard, go for a second opinion or find a new doctor. And there is some research that shows women, if they have a female doctor, they're perhaps better, they're in better hands.